What we did in that paper is we actually had taken data, EHR data, to create a model. And what we were wanting that model to help us figure out is we were trying to identify what patients who are undergoing radiation, either radiation or chemoradiation, that are coming through our clinic on a daily basis, which ones of those patients would be at higher risk for requiring acute care. And how we defined acute care was either emergency room visits or hospital admissions. So we created a model, we tested the model, and it had quite good sensitivity and specificity for predicting which patients were at slightly higher risk. And so the subsequent paper, which was published in JCO now in 2020 or a couple of years ago, was where we actually in our department implemented a randomized trial. So for most patients who are undergoing radiation therapy, the standard practice is that they are seen in a given week, once a week, for a weekly assessment. And during that weekly assessment, the provider is determining what side effects the patient's having, what symptoms they're having, maybe some medication management or modification to optimize their symptom control. So in this trial, we continued our standard of care, which was that once a week treatment visit. But in those patients that were determined by the algorithm to be higher risk, we then randomized those patients to either being seen once a week as per standard versus being seen for an additional visit, so a twice a week visit. And what we saw as a result of this is that the rate of acute care, again, being hospital admissions or ED visits, was about 20% in the group of patients that were in the standard arm. However, reduced to about 10% in those patients who were seen for that directed clinical visit a second time. And so I think this just represents one example of how we can use machine learning and modeling to help guide clinical care. This did not change practice necessarily for patients in terms of what radiation they received or what treatment they received, but it allowed us to utilize our resources most effectively and most efficiently to those patients who needed additional care. And I think what we see here is it results in an improvement in outcomes, but you could imagine that that also translates, and we've done some additional analyses to look at how that might impact healthcare costs. And if less people are needing to be admitted, if less people are needing to seek out care in the emergency room, overall, what we saw was similar to that 50% reduction in acute care. We also saw a corresponding 50% reduction in healthcare costs.